Welcome again. Please, this is the continuation for the prevention of mother-to-child transmission of HIV. If you're yet to see the first video, please check my channel for the part 1 so that you can have a grasp of the whole concept. Thank you. The best time to begin the prevention of mother-to-child transmission of HIV is long before pregnancy. You know what we said in the preconception care health talk video. Planning enhances performance. Get tested for HIV and know your status before pregnancy. If you're HIV positive, you'll be placed on HAART. HAART means highly active antiretroviral therapy. They are also called antiretroviral drugs, ARVs. So when I say ARVs, you know that these are the drugs for HIV. Now, ARVs will help suppress the virus in your blood before pregnancy, and you will continue these medications during pregnancy, delivery, and breastfeeding. But if you're already pregnant, you can still achieve success with the prevention of HIV, from mother to child. During pregnancy, these are the things you should do. Get tested. If you're HIV positive, you'll be placed on ARVs. Take your ARVs every day to make sure that viral load is suppressed. In addition to your ARVs, there are other drugs that will be given to you during antenatal care. Your routine medications, then drugs to prevent malaria for those women who live in regions of the world where malaria is common. These drugs that are given to you, they have different functions for you and your baby. So take all of them according to doctor's prescriptions. If the ways to take these drugs are confusing, tell your doctor so that he or she will state it clearly and direct you how you take them. Then bring all complaints to your doctor during pregnancy. Don't manage any symptoms by yourself, no matter how slight it might seem to you. Then be faithful to your faithful partner during pregnancy. This will avoid complicating your immune system further, especially with other sexually transmitted infections, because it's possible to get infected during pregnancy. So avoid risky sexual behaviors during pregnancy. Also, eat healthy foods, fruits, vegetables, and maintain good personal and environmental hygiene. Then avoid smoking and drug abuse during pregnancy. Stick to your hospital visitations and the advice of your skilled birth attendant. Needless to say that no traditional procedures are allowed except you have discussed it with your doctor and this procedure is found to be safe. What I mean by traditional procedures are all activities that will endanger you and your baby's safety. For example, in some part of the world, some women go for abdominal massage, which they are told will make the baby strong. Some go for intake of herbal concoctions to help prepare them for delivery. Some even go for vaginal preparations, and the traditional attendant will put some herbs into their vagina so that the place will open and prepare for delivery. There are many more examples. Now, for those women who believe that abdominal massage during pregnancy is what makes the baby strong enough to come out at delivery, have you wondered how babies are able to suckle on their mother's breast immediately after delivery? Who taught them before delivery how to suckle? Please, babies are naturally inclined to the process of delivery. They will maneuver their way out. They don't need any external massage to have the strength to do so. Some mothers have lost their babies because of some of these traditional procedures. Do you know that abdominal massage during pregnancy can make your placenta to separate before delivery? And it will risk your baby further, of contracting HIV from you. Do you also know that the process of putting herbs into your vagina can risk you to have some infections or even injury on vaginal wall? And this will further increase the likelihood of a baby getting in contact with your blood during delivery and then contract HIV. Please, amazing mothers, just be careful and stay safe. Then next, plan for your delivery. Plan to get your baby's antiretroviral drugs. Baby needs to take ARVs. If you have to buy them, please make the plan and do so early. If you have to fill a form, please do so on time, just in case of premature delivery, so that we don't wish for it, but if it happens, we are not caught unawares. Now, during labor and delivery, these are the things you should do. Number 1, do not go to TBA's place or traditional birth attendant. The baby can contract HIV from you at the point of delivery at the slightest mistake. Traditional birth attendant does not understand what you're trying to protect. In the process of cutting the umbilical cord, she can even share the same instrument between you and your baby. And that will spoil all the hard work you've done from pre-pregnancy stage. The doctors and midwives are trained to specially protect you and your baby during pregnancy and delivery. So please, labor in the hospital under supervision. Avoid staying long at home after your water breaks. From when your water breaks to delivery time should be less than 4 hours. So once your water breaks, note the time and find your way to the hospital if you are not already there. Then inform your skilled birth attendant at the time you notice your water had ruptured so that a good monitoring will be done. Then delivery can either be vaginal delivery or cesarean section. This is highly dependent on the following: viral load of the mother, the presence of any complications, and then on the mother's choice. So delivery is highly individualized. For example, if a mother has a low viral load and the person can deliver vaginally, vaginal delivery is preferred. However, you have to discuss with your doctor to know the safest option of delivery for you and your baby. Once the baby is delivered, administer the ARVs that's prescribed by the doctor. This should be ready before delivery. So at the point of delivery, have your baby's ARV in your bag, okay? Thank you. Then during breastfeeding, breast milk is the best food for newborn babies. Breastfeeding accounts for 1/3 of all the cases of mother-to-child transmission of HIV, but the lack of breastfeeding also leads to other conditions and even deaths in some babies. Studies have shown that babies who do not breastfeed are 14 times more likely to die from diarrhea, respiratory infections, or other diseases than babies who are given breast milk only at the first 6 months of life. So it is advised that mothers who are HIV positive should please do the following: give only breast milk, no water, for the first 6 months of life. This one is called exclusive breastfeeding. Then add complementary feeds after 6 months while you're continuing with breastfeeding. Examples of complementary feeds are pap or corn grail. Some persons know it as akamo. So give your baby this pap after 6 months while continuing with breast milk. And then try to make it very nutritious by adding milk, soya bean powder, and all that. Then stop breastfeeding when your baby is 1 year of age. During breastfeeding, please make sure you position your baby well. Place your baby well on the breast so that the baby does not give you a sore nipple or cracks or wounds on your nipple. But if you decide to give your baby infant formula, that's all right. But ensure you give only the infant formula throughout. Don't give your baby infant formula, then some days you give breast milk. Don't mix breast milk and water or other feeds when baby is less than 6 months. Okay? This type of feeding is what we call mixed feeding. Mixed feeding is when you give your baby breast milk and water or other feeds after the baby is born, when baby is not yet 6 months of age. It's called mixed feeding. Now, the reason we say don't give baby breast milk and water or other feeds before 6 months is because the intestines of the newborn baby is tender and any bacteria can cause injury in the intestines. So if a newborn baby is taking other feeds like pap and water, if the water used to prepare the feed is contaminated, the baby's intestines can become injured or perforated. And if the mother gives that same baby breast milk, virus can enter into the baby's blood through that injury. And once that happens, baby can contract HIV from the mother. So no mixed feeding. No mixed feeding. No mixed feeding. It's either you give breast milk from birth to 6 months before adding water and other feeds, or you start and maintain the baby on infant formula from birth. Now, there's something called the AFAS principle, AFASS. It stands for acceptable, feasible, affordable, sustainable, and safe. The infant formula you give to your baby must obey the AFAS principle. So the feed must be acceptable by you, your mother-in-law, your husband. Everybody must accept the feed. It must be feasible. So it's possible for you to get it anytime you need it. Then it must be affordable. So it can be consistent. Not after 2 months you say there's no money, then you go and give breast milk. No. So you want to start for infant feeding, infant formula, start with the one you can afford. Then it has to be sustainable and it must be safe for a baby so that you can maintain it and continue. Now, after delivery, as baby is taking breast milk, the baby is also taking the ARVs, and the doctor has to tell you the dosage to give the baby, the quantity. The baby will be on this ARV for 6 weeks. And after 6 weeks, your doctor will change the drug to another type of drug and tell you how long and the quantity you give the baby the drug. Please, mothers, I want to encourage you. Try and follow up with your baby's hospital visitations. Don't be tired. The goal is worth the stress. Once the baby is fed well and the rules are obeyed and give the baby drugs, baby is sure to be safe. Then now, during your hospital visitations, note when the first test and the final test will be done to confirm a baby's HIV status. Please be available for blood sample to be collected from the baby. Now, while doing all of this, if you notice anything like fever or diarrhea, or a baby looks ill, maybe it's not looking healthy, please take the baby to the hospital immediately. Even though the appointment date has not reached, just go, you'll be attended soon. And also take your baby for immunizations. Make sure baby takes all the vaccines for his or her age. Then for you, the mother, continue with your ARVs. Take your drugs every day so that you maintain low viral load and you be in healthy state to care for your baby. Now, if your baby tests positive for HIV, do not despair. Don't be tired. There are teenagers and young adults today who were born HIV positive. You can help your baby survive through and live a meaningful life. With regular hospital visitations and adherence to medications, the baby can actually live a normal life and achieve all the goals that the baby wants in life. Kudos to all the mothers out there who are already doing this. I once heard a mother in pediatric HIV clinic say, "Nothing will make this virus overcome my baby. My baby must survive." That determination melted my heart. So mothers, don't be discouraged, okay? You can achieve success when you do all your doctor tells you to do. Please, prevention of HIV from mother to baby starts from before pregnancy to pregnancy, delivery, and breastfeeding until the doctor tells you your baby is free after the confirmation result says that. So please, mothers have got it right. A lot of mothers have gotten this right. So you too can. Do well to share this video to everyone around you. Share them on your timelines and subscribe to the channel. Just know that you can always come on this channel for very important information. There are very key things you don't want to miss. So please subscribe and then click on the notification bell so that once new uploads come in, you'll be notified. On Facebook, LinkedIn, YouTube, Juliana Ome. On Instagram, at juliana.ome. Do well to follow me. Thank you very much and see you again.